my name is Heema Patel and I'm a student at TCAT Nashville. Today I'm going to be telling you guys how to take a stool specimen. First, you will need to enter a patient's room and identify them using their name and date of birth. Then, you will need to wash your hands properly before you go over to them and explain the procedure and ask for the permission. After you have done that, make sure to don on gloves and ask your patient if they need to use the restroom to pee, because while you're collecting the specimen, you would need to make sure that they do not void into the pan. While you've taken them to the restroom, explain how to use the specimen pan while they're using the toilet. Make sure to tell them that they do not void or put any paper into the specimen pan, and not to touch the pan because it will contaminate it. You will then need to leave the restroom and ask your patient to notify you when the sample is ready. After they have let you know they're ready, you need to make sure they're comfortable and clean before you send them off and you take a look at their sample. You will need to check the sample for any discolorations, the consistency, any odor, mucus, or if it has any blood. Just examine the sample, make sure there's nothing out of the ordinary into it. Using a tongue blade, transfer the samples of the stool from at least 2 separate areas of the stool into the semen cup, making sure to collect any abnormal sample findings like that, the blood, anything that's abnormal to you, such as blood, mucus, or any parasite eggs that you find into it. After you have done that, make sure to put the lid on top of the sample cup without touching the inside of it very carefully. After that, place the label, which had their name, date of birth, date, time, and the name of the procedure onto the cup, and put it in a biohazard bag before submitting it to the lab for testing. This needs to be sent to the lab as soon as possible, because if there is any abnormal findings, they will need to stay alive and fresh while they perform the procedure. After you've done all of that, make sure to doff your gloves, wash your hands properly, and then document what you have found in this sample or anything. Just record the procedure and document everything that you find, any color, the consistency, the date, the time, and the results that were sent back from the lab. And that is how you collect a stool specimen. Just make sure it's very sterile, not contaminated, and if there's anything wrong with it, just make sure you record it and send it to the lab as well so they can take a look at it closely.